Hello, welcome everyone, friends and family. I'm Kevin. 2020 has been obviously a lot of tough times, and in particular for me and my family. My father's been battling a multi-year cancer journey and has had quite a bit of hospital time during the year, and especially during the coronavirus pandemic. So it's got me thinking a lot about ways of giving back and how I can support him and others that are fighting cancer journeys. And in particular, a cause that hits home is children with cancer, specifically the Lucile Packard Children's Hospital that's attached to the Stanford Clinic. So I'm putting together a small charity bike ride and fundraising donation period to try and raise some funds for this fantastic facility, and one that my dad has particularly got to know really well. Appreciate any donation you'd be willing to consider. And also, if you'd like to listen on, you can hear more about my dad's story. Thanks.
I want to thank anybody that is watching this for even giving your time to hear my story. If you donate to Lucile Packard Children's Hospital, it is an exceptional organization to help these children get their 75 years like the 75 years I've had. My name's Michael OLeary. I'm a father of two fantastic sons, a grandfather of two fantastic grandchildren, okay? I've got a wonderful wife of 41 years. I'm battling cancer for the third time in the last 5 years. The doctors really need you to have a really positive attitude, okay? Because attitude is a big part of having success battling this disease. Now I have cancer of the liver. I've been in a chemo treatment. I'm in my second phase. The first phase, the chemo shrunk the tumors on my liver 50% in volume. They tell me that I'll never be cancer-free, but don't think about the cancer as a life-threatening disease. Think about the cancer as a condition as you would diabetes, that we can control and manage that cancer, and there won't be an expiration date on your forehead anytime soon. And the first phase of my treatment before the operation was 6 weeks of chemo and radiation on the cancer in my esophagus. During one of the chemo days, I had a window between the radiation treatment and the chemotherapy treatment. So the Lucile Packard Children's Hospital is right next door to the Stanford Cancer Facility. So I walked over there, and because I was a cancer patient, they would let me in. There were parents sitting with their children in the lobby, and I had just gone through 3 hours of my chemo treatment, okay? And it was hanging from a pole like the one that you may be able to see behind me. And I walk into the Lucile Packard Children's Hospital, and I see children that are 7, 8, 9 years old, and they have their chemo pole. They're sitting with their mother, reading a book, coloring, or whatever. And my thought to myself is that I've had 75 really good years, and if one of us has to go, I want it to be me and not them. To that one, but I want that 7, 8, 9-year-old to get their 75 years. Yeah. Between when my chemo and radiation stopped, my grandsons live 10 miles round trip from where I am, and I started biking over to my grandsons to do that 10-mile loop. And it felt good, because by the time I walked into the hospital on March 31st for the surgery, I felt really strong. But I went into that operation extremely well fit because of all the biking that I had done. He thinks that the track is 2/3 of a mile type thing. He's ridden 100 miles in a day before, maybe even more than that. So when you break it down, it could be 135, 150 laps. Okay, I want to say that I'm very humbled that my son is putting this together. So I want to thank anybody that is watching this for even giving your time to hear my story. And if you decide to donate to Lucile Packard Children's Hospital, I really appreciate it. After what I've been going through and understand how difficult this health journey is for an adult. If you donate to Lucile Packard Children's Hospital, it is an exceptional organization to help these children get their 75 years like the 75 years I've had. Thank you, thank you, thank you.